just a nice little pillow under his belly, under his legs, so his belly stays nice and relaxed, okay? And then we've got our, wasn't there another, did we get another one? Oh, I think it's so what we're going to do on this one is we want to get him draped completely, okay? So think about a guy that is, it's a little cold in that exam room, and we want to get him draped properly. So the way to drape is, are you sure you're okay with me demonstrating? Okay. So the way we drape, when you're going to move the gentleman's or the woman's top of the shorts down, the best way to do it is to put your hands inside the towel, and we're going to just curl it under, and we're going to bring it down, and you know my rule. Y'all know it? Since
yes.
You're videoing me, I'm going to post it online. 1 pubic hair. Okay? Easy down there. Biggest mistake people make is they've got it to here, and now you don't have 4 quadrants exposed. You only have 2 1/4. Okay? And then we don't need to, we can drape him probably up to the xiphoid process and just at least cover him up so that he feels a little bit better. Okay? And then, I can read this stuff. We're going to go through, obviously, do your, hi, I'm Deb Knight, I washed my hands today, and I understand you're having some abdomen problems. And I clean my stethoscope also. And then I would note on general survey any obvious protective posturing of my patient, any jaundice, any diaphoresis, any obvious pallor, or if he's had some shallow respirations. And then, again, positioning is knees flexed, comfortable, and are you comfortable? And also hands down at sides. A lot of your patient models will want to put their, especially gentlemen, will want to put their hands up here to get them out of your way. Get them down by the sides because his belly is going to be most relaxed there. And then we're going to just look for any obvious signs of inflammation, any visible masses, any obvious striae, any dilated veins. Show my page. Any obvious hernias, and could you crunch up like you were doing a partial sit-up for me, noting any obvious hernias when he contracts. I'm going to look at the contour and fullness of the abdomen, also from the top and from the side. And then the umbilicus for its contour, and any signs of any obvious hernias, inflammation, any evidence of peristalsis, the aortic pulsations, and also the symmetry of the pigmentation, any gray Turners or Cullen sign, and you're going to go through and do just a quick, I noticed periumbilical ecchymosis and also ecchymosis on the flanks for Cullen's and gray Turner signs. And then we're going to just take a listen. I'm going to pretend these are in my ears, okay? And we're going to take a listen with we can use our diaphragm, and I'm just going to listen in 4 quadrants, noting the bowel sounds. And I'm going to also go ahead and listen for the any bruits in the 4 quadrants. I'm going to go in the arterial bruits. And over the aorta. And then I'm also going to listen for the femoral arteries, and on the femoral arteries, what we'll do is we're going to go, I think we've done these already, we're going to make sure you move the towel and the drape, and you can go right over the shorts in our patients, and listening for femoral bruits. And then we're also going to do friction rub and over the spleen. And I usually get a couple of places, right at the costal margin. And over the liver and spleen. Okay, I think I got these. And then we're going to go ahead and percuss. And you're going to just feel my hand touching. I'm just going to do some percussion. I'm going to catch the 4 quadrants, and I'm also going to get along the costal margin on both sides, and then once in the middle, and then head down into the left lower quadrant, cross the symphysis pubis area just above it, and in the right lower quadrant. Good. And I'm going to go ahead and if over the, across the symphysis pubis was where the bladder was also. And then I'm going to go ahead and check for some splenomegaly. And we're going to go ahead and get, you can just leave your arm right at the side if you want. Yep. And we're going to get in that, about that 10th rib. And we're going to be in the left anterior axillary line and start percussing. And can you take a big breath for me? And let it out. Good. And I noted that there was no change in the percussion note. Then we're going to also do the spleen for size. And let's say that there was splenomegaly noted by that test. I'm going to go ahead and I'd start at midline and I'd come across until I heard the dullness, and I'd go ahead and make a mark. And let's say it got dull there and make a mark. And make a mark. And bottom one went all the way through. And then I would make an attempt to measure that. We also need to measure the liver. And on the liver, we really do, I'm going to make some marks on you. I'm going to start nice and low here. I'm in the mid-clavicular line. Do it one more time. Oh, we have a liver that's... There we go. And so I'm going to go ahead and make a mark. And then I'm going to start above, in mid-clavicular line, above the liver, and I'll percuss down. Thank you. And I'd make a mark, and then I would go ahead and measure the distance between, in centimeters, between my marks. We have about 4 centimeters there, so a very, very appropriate size. Then I'm going to go ahead and I'm going to push on your belly a little bit, okay? I'm going to first push with just very light tenderness, light pressure, excuse me. And I'm going to watch your face during this one. And I, as a tester, watch the students' faces as they palpate through the 4 quadrants lightly. And then I'm going to push a little deeper. And I'm looking for my patient to have any obvious distress or evidence of pain as I push through. And then I'm going to go ahead and check the liver edge. And I'm going to start low, actually near the umbilicus for my first one, okay? I know your liver, after I percussed, it's not hanging down there, but I'm going to start low. And can you take a big breath and let it out? And I don't feel anything there, so I'm going to go up a little higher. And let it out. I'm going to do it one more time. And let it out. Good. So I palpated the edge of that liver, and I also would note a Murphy's sign would be a halt in inspiration because there was pain in the gallbladder area. And so obviously you did not have that. I'm also going to palpate your spleen tip. And I'm going to ask you to take a deep breath and let it out. Again. And let it out. Good. And then I'm going to go ahead and palpate the kidneys bilaterally. Deep breath. One more. Good. And then on the opposite side. And let it out. Good. Again. Perfect. And then I would also palpate the inguinal lymph nodes. I could have also palpated them before when I was auscultating them, if that was easier to do, and noting any obvious tenderness. We're going to go ahead and do some special tests here. Let's say that you came in with appendicitis. I'm going to go ahead and demonstrate a couple of problems, or a couple of areas that we would want to note. The iliopsoas, I'm going to have you take lift your leg up and hold it up there, and don't let me push you down. Good. Does that cause you any pain? Yeah. Can you show me right where? Yeah, it should be midline between the hip and the umbilicus. And then we're also going to do another test for this, and I'm going to go ahead and bend your knee. And I'm just going to rotate you a little bit, in and out. Does that cause you any trouble? Okay, and so the obturator is positive on that, because that would cause pain. I'm also going to do some silly little tests. Oh, we don't have jar on there. Oh yeah, thank you. And there are a couple ways to do the jar. I could check to the table, or I could do, and you want to get a good in there. And again, you're watching his face to see if that bothers you. And then, or another easy way to do it is not to lift the leg, but to dorsiflex the ankle and then tap hard on the heel and ask the patient if there a positive would be any pain in that area. And that would indicate that we had a peritonitis. And then we're also going to do shifting dullness. And actually, we have some other things. We have rebound, we have some rebound tenderness. And let's say it was at appendicitis again. I'm going to press inward. And if he had pain in the right lower quadrant, I'm going to press in. And I'm going to ask him, is there any pain? And then I'm going to pull out fast. Was there any pain on the pulling out? And a positive would rebound tenderness would indicate also peritonitis as I came out. Then we're going to have referred rebound. I'm going to go over to the opposite side. I'm going to press in, come out. Did that cause any pain over on that right side? And a positive would be yes. Also going to do cutaneous hyperesthesia, and basically in that same area, you can stay with your appendicitis if you like, and I'm going to just touch gently, watching the patient's face, seeing if there's any discomfort, and a positive would be yes, there would be pain on light cutaneous hyperesthesia. And then we've got our shifting dullness. We can just describe those, but basically what I would do is I would percuss out the belly on one side, and I'd be percussing out to find when it went from tympany to dull, and I would go ahead and make marks there. And then I'm going to ask you to roll over on your left side, and I would ask him to wait there for just about a minute or so and let that fluid all move downward. And now, if I started in that area, midline upward, I would note that my line moved where it changed from dull to tympany, and it actually went down a little bit here into this area, and but the line basically moved, and it became tympany up here and dull below. And then can you go ahead and go back down? And a fluid wave would be the same thing. I could either with my hand, or I could ask the patient to hold the hand right here, and I would literally push fluid through, and I can see that a little wave of fluid actually came out on the opposite side that I was that I had on the opposite side of my hand on the midline of the abdomen. And then I would also note the need for a digital rectal exam, and also, if it was a female, a pelvic exam. And then lastly, can I ask you to sit up for just a second? And I'm just going to give you a gentle tap here. And does that cause you any discomfort? Good. Any discomfort? So that's the end of the exam. Thank you. What did I miss?